We go back to our leaflet that we started speaking about, and so the leaflet is about gastroscopy procedure, and so as you see here in the picture, the doctor discusses this procedure with the patient. Now it's time to read. Now the first part of the text on the leaflet is here, leaflet about gastroscopy, and the first part, which is called "What preparation do I need to do?" Let us listen to Prerna. Prerna, are you here?
Yes, ma'am.
Read it, please.
Okay. What preparation do I need to do? The hospital department will usually give you instruction before your test. These commonly include: don't eat for 4 to 6 hours before the test. The stomach needs to be empty. That is, small sips of water may be allowed up to 2 hours before the test. Second is, if you have a sedative, have somebody accompany you home. Third is, if you are taking any other medication, tell your doctor. It may need to be stopped before the test.
Okay, I think everything is clear here in this part. Well, so the next part is for Nishat. Read it, please.
Yes, ma'am. What can I expect after gastroscopy? Most people are ready to go after resting for half an hour or so. If you haven't had a sedative, you may take a bit longer to be ready to go home. The sedative will normally make you feel quite pleasant and relaxed. However, you should not drive, operate machinery, or drink alcohol for 24 hours after taking the sedatives. You will need somebody to accompany you home and to stay with you for 24 hours until the effects have fully worn off. Most people are able to resume normal activities after 24 hours.
Okay, good, thank you. Now let us move to the next slide, and so let's listen to Prakriti.
Yes, ma'am. Is gastroscopy is reliable? Gastroscopy is a good test for the seeing abnormality in the upper gut. However, it is not a foolproof. For example, gastroscopy may not detect a small number of cases of early ulcer or early cancer.
Okay, I think we were speaking about, when we were speaking about the stress in this word, what is a better way to pronounce? We say gastroscope, but gastroscopy, the second syllable should be stressed here, gastroscopy. Okay, good. Now, Samhita, this is for you.
Yes, ma'am. Are there any side effects or complications from having a gastroscopy? Many gastroscopies are done without any problem. Some people have a mild sore throat for a day or so afterwards. You may feel tired or sleepy for several hours if you have a sedative. There is a slightly increased risk of developing a chest infection or pneumonia following a gastroscopy.
So you see, this is about complications. Now the next part is for Rafael.
Yes, ma'am. Occasionally, the endoscope causes some damage to the gut. This may cause bleeding, infection, and rarely perforation. If any of the following occurs within 48 hours after a gastroscopy, consult a doctor immediately. Abdominal pain, fever, difficulty breathing, vomiting blood. A small number of people have heart attack or stroke during or soon after gastroscopy. These serious complications are rare in most people who are otherwise reasonably healthy.
Well, very serious piece of information. Now, let us have a look at the questions that cover the content of the article, the leaflet. So let us answer the questions, and now let's listen to Aymin. The first question is for you.
Yes, ma'am. The first question is, what do you need to do for 4 to 6 hours before the procedure? Ma'am, the patient should be empty stomach before for 4 to 6 hours before this procedure, ma'am.
And so that is
No,
why
small
the patient should stop what?
eating.
Eating. Okay.
Yes, ma'am. Before 4 to 6 hours.
Now, Arun Chalam, please, the second question.
How will the sedative make you feel? It will make us feel unconscious. We should have somebody accompanied us with us if we have a sedative.
Relax and calm.
Relaxed.
Busy.
Tired and
Present
sleepy.
and relaxed.
Tired and sleepy.
When we take a
Sleepy.
sedative.
Tired. Okay, good. Yes, so the next question is for Madhumita.
What should you not do for 24 hours after the sedative? We should not drive or handle any machineries, ma'am.
Because it's dangerous. Well, and the next is
Drink
for...
alcohol.
Sorry? What did you say?
Or drink alcohol, ma'am.
Yes, and
We
drink
should not.
alcohol. Yes, you should. Divya, please.
Yes, ma'am. What do you need after the operation? We have somebody accompany with us.
Yes. Okay. Okay. Good. So, Priya, please. Priya.
Yes, ma'am. How successful are the result of the test? Ma'am, it can examine our upper gut.
Sorry, will you repeat, please? So, how successful, Priya? Okay, let's go to the
Ma'am, it is not a foolproof for the earlier ulcer or earlier cancer.
Yes,
it's only for seeing abnormalities in upper gut.
Yes, ma'am.
So
and it cannot detect small ulcers, ma'am.
It can detect some.
It is good for seeing abnormalities or any dysfunction.
Ma'am, it cannot detect. But ma'am, it cannot detect the earlier ulcer or earlier cancer. So ma'am, it is not foolproof.
Small ulcers.
Not foolproof. Only in the upper gut.
Yes.
Abnormalities in
Yes.
the upper gut are visible. Okay, so that was who? Priya. Yes. Now let's listen to Prerna.
What do some people have afterwards? Ma'am, some people might have some problems, and it is advised that they should consult a doctor after 48 hours of gastroscopy. They might feel pain in the abdomen, and they may have breathing difficulty or blood vomiting, fever. So at that time, they should consult their doctor. Some people might feel such complications after the procedure.
Yes. Sometimes the complications are even more serious, but it happens not very often. Okay, thank you. So this is the information about this procedure, gastroscopy procedure. Now here are so the sentences that describe this procedure, and our task is to find the adverbs of frequency in the sentences and put them in order, starting with the least frequent. So adverbs of frequency. So in the first sentence, let us listen to Nishat.
Yes, ma'am. Procedures like this are usually done under sedation.
Where is the adverb of frequency? How frequently it's done?
Usually, ma'am.
Usually, okay. Then the next is for Prakriti.
We often get patients who have no complication.
Adverb?
Ma'am, often.
Often, okay. So then Samhita?
Fortunately, we have never had a patient who has had serious complication with this procedure. Ma'am, adverb.
Adverb, where is it?
We had no. I'm sorry, ma'am, I don't know about this one.
So it says how often something happens here in this sentence.
Never
They
had.
never had.
Yes,
Never
never.
had.
Never had.
Adds some characteristic to a verb.
Yes, ma'am. Never had.
To have, never. We never have. Yes.
Never had.
Okay. So the next is for Rafe.
Yes, ma'am. The procedure rarely goes wrong. Rarely wrong.
Okay, and I mean now.
Yes, ma'am. It always takes me a while to recover from anesthetic. So the adverb here is always.
Always. And
While. While.
while. Okay.
While.
Yes,
Yes, ma'am.
now the next is for Arunchalam.
Yes, ma'am. Patients sometimes get a headache afterwards. Sometimes is the word.
Sometimes. And so if we put these adverbs of frequency in order, starting with the least frequent. So we have usually, often, never, really, always, sometimes. Least frequent. Which of them is least frequent?
Never.
We have never had a patient. Never.
So then what goes next after then?
Rarely.
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 While.
While. Huh?
Sometimes.
Sometimes.
While must be
while.
not adverb.
And while.
What about?
Often.
Often.
When
Often.
it's often. Then
Then
usually.
usually.
Always.
Then usually.
And the last is
Yes, ma'am. The most frequent is always.
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 always. You're right. They are never, rarely, sometimes, often, usually, always. They are marked here. Okay. And do we know any synonyms to the to these words? Rarely, sometimes, often, usually. Are there any synonyms to rarely? The words which will say the same, which have the same meaning.
Rarely, like
Hardly.
we can say.
Or infrequently.
Yes.
Seldom, yes, there is a word.
Yes, ma'am.
Yes.
Seldom.
We can say not often, rarely. What about sometimes? Sometimes.
Occasionally, we can say. Occasionally.
Occasionally. From time to time.
From time to time.
Yes, okay. Now and then. From time to time. Okay. What about often?
Frequently.
A lot.
Many times. A lot.
Many
times.
Regularly.
A lot.
Ma'am, are exactly.
Regularly.
And usually?
Normally, like
Generally.
generally.
Generally, ma'am.
Generally.
Regularly. So
Yes.
Regularly.
commonly.
Habitually.
Okay. So here are the synonyms to these words, as you see. Okay. And these adverbs are can be used with the verbs in the present simple. Yes, in the present tenses, because this is about some typical actions, some common actions. Now we're going to listen to some information This is mhm. Before we start listening, let us just focus on the question. What are the possible complications of a gastroscopy? One more time. What are they? Complications. We read about them.
Ma'am, heart stroke, them.
Heart stroke.
Heart attack.
Complications may include like bleeding in the gut, ma'am, then
Mhm.
infection, ma'am, and rarely perforations, ma'am.
Yes.
Also,
Then-
ma'am, pneumonia.
Then
Heart attack, heart stroke, ma'am.
a very less number of people may have heart attack, ma'am, or stroke during this procedure.
Mhm. Mhm.
Rarely perforations and infections, bleeding.
Yes, right. Okay.
Mm.
Now we're going to listen, and we should list the complications that the doctor mentions. Okay. So please prepare a sheet of paper just to list the complications. Now let's get started.
Listening 4.
Can you hear?
Yes, ma'am.
Mhm.
Listening 4.
Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut, and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
Mhm. Well, I think it was easy to understand. So, what kind of complications does the doctor speak? What are they?
Ma'am, bleeding.
Occasionally,
Most of the time,
sore
there
Mild
will
sore
be
throat
mild
for
chest
a day or
pain,
two, ma'am.
or day
or
or
bleeding.
Pneumonia, ma'am.
Then
Mhm.
after the
Yeah.
sedatives, the
Chest
patient may feel
pain.
tired, ma'am.
two. Due to
Why do you-
There may be chest
sedative, there
infection
will be
and pneumonia,
tiredness
ma'am.
and drowsiness.
Pneumonia, yes,
So,
infection.
There
Okay.
may
also,
be
ma'am,
bleeding or infection of the gut.
there may be bleeding
Yes, ma'am.
and infection of the gut, and it
Occasionally,
can
in
also
very
cause
rare
It caused
cases.
the pneumonia.
Mhm. And
Puncture in gut.
what was the first the effect that the doctor mentioned?
Mild sore throat,
Mild
ma'am.
sore
Mild
throat.
sore throat.
Mild sore
Mild
throat.
sore
People may
throat
have mild.
for a
Okay.
day or two.
Mhm, mhm. Okay, so we are right. And why does the doctor point out the side effects to the patient?
Like
So
before,
that the patient should be well aware of everything,
aware of the
like side
condition which
effects
he may
so that the
about its
patient is well,
procedure.
so that
Exactly.
the patient is well aware of everything before signing the consent.
Yes,
Yes.
because the
Consent.
consent
to avoid further complications.
informed consent. Yes,
Yes,
so that the patient has all the information about the procedure. Okay, and the question: what phrases does the doctor use for occasionally, automatically, or seldom?
Occasionally.
Let us
Like
listen
on
for
the
the second time and let's just focus on these phrases, okay?
Listening 4.
Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
Instead of occasionally, what does the doctor use?
In most cases,
Yes.
On
Sometime I
occasion,
think
something
or
like
some
that.
Odd
occasion.
occasion.
Yes,
on
he
odd,
says, she
Odd
says in
odd
the odd
occasion.
occasion.
Not
The odd
necessary.
occasion.
Odd occasion.
Automatically, instead of this phrase, what was the phrase used by the doctor?
Necessary.
Not
Yes,
necessarily.
that's not, that
Not
does
Not
not
necessarily.
necessarily
Yes.
mean necessarily, okay? And instead of seldom?
Rarely.
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 Right, yes.
Minor?
Yes, really.
And so 3 ways the doctor makes the complications sound less threatening.
Some people can have mild sore throat and the chest infection also, which leads to pneumonia.
Also,
And endoscope can, like on odd occasion, can cause bleeding.
On the odd occasion, yes.
Yes.
And the doctor says, I can assure you, right? Or, but remember, this does not mean that you will necessarily get this as well.
These infections.
Yes.
And she says, but this happens very rarely.
Rarely.
Very rarely. So the phrases that help the patient to understand that the procedure is not so threatening and dangerous, right? Okay. And
Listening 4.
we won't listen. Now, acknowledging a visual cue. So now when doctors see a patient showing emotion, they can make a comment or observation. This is called acknowledging a visual cue. And so I would like you to have a look at this slide. And so here you can see the pictures and some phrases, some sentences, and the task here is to match each picture from A to F with the statements from 1 to 6. So let us just read the statements and then just match them with the pictures. Let us listen to Rafael. The first sentence, please.
Yes, ma'am. It's better to let it all out rather than boiling it.
So you see,
it might be it might be E, ma'am.
Might be picture E. Okay, does everyone agree with this?
it might be B because the person is thinking that I should do.
No.
It can be C as well because the person is crying, so he might want to open up.
Yeah. So the patient is letting all out, yes?
It all.
All the emotions out, and the doctor just comments on this. That this is better than boiling it up. Okay. So the second, please, the second sentence for Iman.
Yes, ma'am. You look very happy to be going home. It should be, ma'am, picture D.
Picture D, yes, a happy face of the patient. Okay.
Yes, ma'am.
Well, and next is for whom? For Arun Chalam.
Yes, ma'am. I can see you're a bit alarmed by the procedure. Ma'am, it's A.
Which one?
A, option A, ma'am.
A or E?
Or F.
Or what? Alarmed. What about, okay, yes?
B, ma'am, alarmed.
Alarmed.
No, no. A.
No, ma'am.
No,
It can
A
be
is for
ma'am.
a
confused.
specific.
A is
Agree.
alarmed.
A.
Yeah, or F one.
A,
B is for
all right.
confused.
Okay, now Madhumita.
You look rather nervous about this. Yes, ma'am.
Which one?
Yes.
F. Yes, you say.
You look.
Okay.
Yes, ma'am. Picture F.
So, I mean, we should
Picture F.
understand the difference just in emotions expressed in pictures A and F. So here, alarm
Yes.
is very obvious emotion. Yes, but nervous is like biting the nails, like something like this. Okay?
Hmm.
And the next is for Divya.
Yes, ma'am. I can see you. You are in pain, ma'am. Picture E.
Picture E, yes. The
Yes.
doctor should do something with this. And the next is for Priya, please.
Yes, ma'am. You look a bit confused by what I have said. Picture number B.
Yes, this is confused. The patient is confused. And so here are the examples of comments that can be done by a doctor to a patient who is experiencing such kind of emotions. And now the next step is here is to complete each doctor's response by adding the most suitable development to reassure, when doctor reassures his patient. So I mean that, so we have to find the phrase that matches with the phrases with each phrases that are given to the left. Now let us listen to Prerna, the first sentence, please.
Yes, ma'am. It's better to let it fall out rather than bottling it up. For this, ma'am, this would you like me to get you something? Or
Okay, like a glass of water, for example. Or
yes, ma'am.
the other phrase is
Or other phrase can be. So I won't keep you long.
No, ma'am. Actually, first sentence is matched, ma'am, already.
the first sentence. Laughing. Okay. Okay. So good. Well, that was the next is for Nishat.
Yes, ma'am. You look very happy to be going home. And the matching point, ma'am, is but remember, you are very lucky we caught it early.
Okay.
So I won't keep you long.
Yes, so I won't keep you long is good.
It's been hard, maybe that one.
Okay. So then let's listen to, who was that? Prerna? Yes.
Nishat.
Nishat.
Now the next is Prakriti.
Yes, ma'am. I can see you are a bite by your procedure, ma'am.
You are a bit alarmed. So
but it won't take long.
See, but we'll soon give you something to. So,
but it won't
there
take
is-
long and it's pain free.
But it won't take long and it is pain-free.
Yes, and this phrase, but will soon give you something to help you relax. So there's no need to worry. Also works in this case. Okay, good. Yes, Samhita, please. The next phrase.
You look rather nervous about this thing. The matching phrase can be, but we will give you something to help you to relax, so there's no need to worry.
Okay. And the last phrase also good in this occasion. Yes. Okay.
Yes, ma'am, but it won't take long and it's pain-free.
Rafa, please.
Yes, ma'am. I can see you are in pain. but will soon give you something to help you relax. So there is no need to worry.
Mhm. Or there is a phrase, would you like me to get you something?
Something, yes, ma'am.
Painkiller.
Yes, ma'am.
Also
Yes, ma'am.
in this situation.
Yes,
Now, I mean, please, the next sentence.
yes, ma'am. The sixth one is you look a bit confused by what I've said. So it will match with this E sentence, ma'am. So no, not E. D1, ma'am. You look a bit confused by what I've said. So would you like me to go over it again for you?
Exactly, yes, to clear out all the
Yes.
details of the procedure.
Confusions or doubts.
Okay, so the doctor should make everything just to calm down the patient, to reassure the patient, to make him or her feel comfortable. Now, the question, in your country, what would you say to a worried patient, or what would you do if the patient is alarmed before the procedure? Yes?
We would offer them water and ask them to calm down.
To relax themselves.
We will reassure that it
Only
won't take
words.
It is
long, or it is pain free and you don't have to be worried. And we will ask them if they have any family member with them,
Mhm.
so that we can talk to
For
them and we can help,
company.
so that they can feel, the patient can also feel better that yes, it is, the procedure is going to be easy.
And in your culture, people tend to show off their emotions. Just can you just judge from the appearance of the person that the person is worried? Or do people keep the emotions? How
Some
do
might keep their
We can
emotion
judge,
within
ma'am, by
themselves,
Depend on the
or
people, like
it vary
they may
among
show, they may not show.
Majority of people can be judged by their facial expressions.
I see.
Yes.
Mhm. Yes, it's very hard to be calm when you are worried about something, right? Mhm. Okay, good. Now, so it's time to speak about the home assignment. Well, you can see here the names of different procedures and tests. And so we've read the leaflet about gastroscopy, and you remember, you understand how the information is organized on the leaflet. And we should prepare a leaflet that gives a patient information about these 6 tests and procedures. Don't ask me to read it, because I can read like colostomy or ERCP, but this very long word is hard to pronounce. Bronchoscopy, herniorrhaphy, blood test.
Herniorrhaphy.
Okay, chemotherapy. Okay, so you see,
Yes,
there are 6 procedures here, and you should organize the information about these procedures. Of course, you'll find this information on the internet, and you should organize like it's given, the procedure is given on the leaflet about gastroscopy, and you should prepare the presentation, PowerPoint presentation about this. Well, as far as there are there should be 12 students. It means that every 2 students should take just you may work in pairs. I mean, you 2 students will be working on each of the procedures here. Do you see? And Arun Chalama is the leader of the group. You please just distribute, just tell who's going to be preparing each of the procedure. Okay, Arun Chalama?
Okay, ma'am. Yes, ma'am.
So I mean that in such a way that the procedures won't be repeated. Well, so, and just a minute. Yes, and some just words, something that you should follow. So in the leaflet that you present with the help of the PowerPoint, you should use bullet points if necessary. Make no more than 5 slides in total. So no more than 5 slides. And next class will be watching your slides and listening to what you've found. But please just upload the presentations to the Moodle site. Just the deadline is, as we usually do, this is Saturday night, yes? And write about each complication separately. I mean, in separate sentence, a separate phrase, and use the following words and expressions that can help you. Sometimes, occasionally, rarely, there are some people, not everyone. And try to use the present simple, active and passive, and imperative for actions. So, I mean, you should follow the example of the gastroscopy, which is described in the leaflet that we've read. Yes, I mean that this is the task, and for the weekend.